When did the full weight of the gravity of this pandemic set in for you? I study in a school that's known for not cancelling CL, but the city has been flooded. Lightning storms, blackouts, everything you can think of, and the school was still open. When they said they were switching to online learning, I knew shit was going down. How's college at home for you? Actually just started my vacation period after my last year of high school. It was an interesting experience, but I'm glad my first year of college will be at an actual school. I had already lost my job before the lockdown happened. The one I just before the lockdown was for a bar which got shut down at the end of March. I have a mortgage and a school-aged child, and had just separated from my wife after being together for 21 years. For the first time I was truly on my own with an eye-watering amount of debt and no idea what to do. So what did you do? Sounds brutal. I ended up working for the catering department of a really nice old folks home. I thought it would be terrible, but old people are really nice, and the people who end up looking after your parents and grandparents are for the most part really kind and selfless. Having now seen end-of-life care and the day-to-day of dealing with dementia, I'm humbled to have been given such a job. I have guaranteed hours, and I'm COVID tested weekly. Once the vaccine rolls out, I will probably be one of the first to get it. I live in New York City, so seeing images of places like Times Square virtually empty, relatively, was something else. I live in a ski town. Having it snowing in March and the mountain and town completely empty was so surreal. The scenes in Spain, the elderly homes that were abandoned, and the army going in to collect all the dead bodies. I still get flashes all the time. It's so horrifying. The photos of those doctors with bruises around their faces and the pain in their eyes. Yup, I live in the UK, and I think a lot of us thought we'd be okay. Then the news started coming in from Italy and Spain, and we knew it was worse than we could have ever imagined. The thing is, the UK had a load of cases itself, but places like Italy with just tons of old people. I've been to Italy. In the outskirts only old people are there, would just make it so deadly to them. When my boss called me into her office and asked me whether I could work from home as a precaution so that the entire department would not be paralyzed if somebody were infected. This was in March, I believe. I'm still working from home. When China locked down Wuhan, if the Chinese government, not known for caring about human life, thought locking up 5 million people was the better option, then COVID was going to be bad. Yup, I had not heard of Wuhan before, looked it up, and learned that it is much bigger than New York City. The thought of locking down New York City is staggering, and China did just that to Wuhan. Fuck. I was talking to my friend last month about the pandemic, and she reminded me that I kept bringing up Wuhan and that cruise ship in Japan with all the people quarantined in December/January. She said only for that shit have, though it would be like Ebola. Sad but not important. When a bunch of billionaires decided to willingly suspend the NBA season, people that process that much money don't just decide to halt ticket sales for their cash cow sports franchises without a damn good reason. I was never one to not believe in COVID, but when they shut down the NBA, I knew they wouldn't give up all that money for no reason. The first time I had to use an unapproved app on my phone so a family could say goodbye to my patient. It was emotional and more distant than it should have been. March. Very early in the year, I teach Chinese kids on the internet. They were getting locked down and telling me they hadn't left the house in weeks, so I started following the story. I was the crazy guy in like January, telling everyone this was coming and they better pay attention, and it wasn't just going to be a 2-week shutdown. Told you so. When everything in the country had to close, it felt like the world just stood still. Every workplace closed, all shops closed, restaurants closed, fast food closed. Facts. Never forget when the streets were basically empty. Not many homeless people. No people walking around. Barely any cars on the road. Everything felt empty. When you go for toilet paper shopping and find empty aisles. When I was up in Montana, one of the semi-trucks transporting all the bread for the town flipped on the icy highway and we were straight out of bread and TP when the whole thing started. Early on, some experts were saying it wouldn't end until 40-70% of the population gets infected or vaccinated. That's when it hit home for me. I was like, wow, that's a big number. For me it's when the whole thing kicked off. Went to food for less and almost everything was gone. This was at the start of the water/toilet paper craze. I'll never forget this random old guy next to me say we will get past this and everything will go back to normal. Probably one of the most real moments in my life. Pretty much from the get-go, I had just gotten to an island in the middle of the Pacific from being on a boat for a while. Borders were closing on us fast. The local government wanted all outsiders out now, and we had to make very important decisions very quickly. It felt like choosing your starting position in a zombie apocalypse or dystopian future game. But Arl, what did you choose? Question mark? Question mark? Going back to live with my parents. We live 4 people in a 2-bedroom apartment, but the country I'm in is doing okay, and I was very glad to have gone back before it was too late. The friend I was traveling with had a uni spot, but wasn't able to go there before the borders closed, even for residents or similar. When I had to homeschool my children, it all felt very surreal. In March, when the WHO, World Health Organization, announced it as a pandemic, I thought to myself, oh shit, this is really serious. I'm baffled at how people treat it now though. With millions of cases and nearly 1.5 million recorded deaths total. Stay safe, please. TBH, it still hasn't. I take all the precautions, but it's really hard to understand the impact of it without anyone I personally know having contracted it. I think with just how crazy the world feels right now, it's hard to be anxious about so many things. But that doesn't mean anyone should take it lightly. From Louisiana here, and a nurse. I was working at a LTC facility, nursing home/rehab, and one day in March on my way to work, Governor Edwards was holding a press conference that I was listening to on the radio. I knew things were already bad because of the temp checks and masks, but what he said that day floored me. He was giving incredible numbers for the amount of new cases statewide, hospitalizations, and deaths. He compared those numbers to what they were seeing the week and days before. The difference was staggering. He also said they were instituting shutdowns and erecting temp care facilities for COVID patients, and that the hospitals were almost to capacity. He said that the N95 masks were in short supply, and that they were starting a website to recruit volunteer healthcare workers to help with the hardest hit communities like New Orleans. I pulled over and cried. Then I went to work. Things haven't been the same since, obviously. March, the state I'm in was an early adopter for masks. That kinda freaked me out. When the massive layoffs started coming. When the ICU beds kept filling up in my hospital, Scripps San Diego, until we had to negotiate with other hospitals in the area to share COVID patients. Hundreds of healthcare employees have tested positive since March. Pretty much chronically short-staffed now, because our teams have lost workers, temporarily or permanently, to COVID. We're ducking mask people! Exclamation mark. Every day now is fresh new gravity. The worst of times beyond anything I could have imagined. Life was so good before, and I didn't appreciate it enough. I've never heard the phrase fresh new gravity before, but damn does that encapsulate how this year has felt, and continues to keep feeling. I was out camping with my friends on spring break. On day 3, I get the notification that 2 NBA players, Rudy Gobert and Donovan Mitchell, have contracted the coronavirus. 5 minutes after this announcement, the NBA announced the suspension of the season. My friends and I proceeded to watch the dominoes fall as everything began shutting down/postponing. When I was able to step outside and heard noises of nature all around me, no drones of airplanes, traffic, lawnmowers, etc. It was eerie. When I heard about a virus in Wuhan, that blew my mind, and knew it might get bad. Can't believe it's been over a year now. I remember me and my friend joking about it, thinking it would die out before it reached the US. Same, we thought it would be like the Zika virus. When my college-age cousin committed suicide because of crippling depression related to isolation. I'm so sorry for your loss. My wife may never see her 94-year-old mother in person again as she lives in a city far away. Tom Hanks Day. 2 times. First was driving back through Nick in April and seeing freezer trucks full of the dead. That is when I realized the extent of the pandemic on society. Second time was just the start of November, when I went through a breakup and realized that I'm just cripplingly alone during this pandemic. I'm a social person with social hobbies and now I rarely see or talk to anyone. I have never been closer to suicide. I'm doing slightly better this week, but that's when I realized the impact of the pandemic on my psyche and ability to connect to people. Damn. Wishing the best for you. Honestly, when lockdown talks started, when they started talking about it in my state, especially back in like February, I still kind of thought that it might never get to the rural Midwestern United States. When my employer started taking safety measures, this is a massive corporation that exclusively focuses on making money, and they started doing things that actively agitate the customers. You know it's bad when the 1% is scared. Currently a barista at one of the largest coffee corporations in the world, in Surrey, BC, Canada, an absolute epicenter RN. We opened our cafe back up for dine-in in July, I believe. Masks were mandated by the corporation September 14th. Back when things were still alright, there was a lot of resistance. Customers got mad, etc. There were horrible gaps in how we should deal customers not wearing masks and the standard what the corp says versus what your manager says crap. Then masks were provincially mandated in all public indoor areas, excluding schools, which is dumb. After months of pleas and resistance from Marfo. Then last week, despite having tremendously surpassed our sales goals since reopening, the corporation shut down our cafe, of their own volition, and have switched to a to-go model again. People still have the nerve to walk in maskless. It really blows me away how many people want to just pretend the virus just doesn't exist. But then when someone they care about catches it, they expect us to pity them and give them special treatment. Ridiculous. When airline travel was brought to a halt in February, my mom was flying back from Russia and cut her trip short by a few days because of my panic. She made it back to the US just a week before both Russia and US put in restrictions. My boss doesn't give a duck about his workers. They talked a big game of keeping us safe, but his wife has confirmed corona, and he's still here walking around the shop without a mask. Some of us are on the verge of quitting. I'm not sure where you are, but I'm pretty sure that contravenes some kind of health order. Contact your province's/state's covered authority and report him. He'll get a nasty fine, at the very least. When I was stuck in a city where I knew no one, and I was pacing my studio apartment talking to myself just to hear the sounds live humans make. When the kids studying abroad in Italy were forced to come back. My mum is a nurse at the hospital where covered patients are treated. She's a diabetic specialist, but the wards are so overcrowded with covered patients she was forced to help treat them. I say treat because covered patients are being transferred from covered wards to normal wards. So the spread was uncontainable due to higher-ups' decisions. There were initially 12 patients. Yesterday they counted 97 in the space of a few days. She came home crying and writing her resignation letter because of the sheer demand and pressure she is under. She's terrified, especially being in her 40s and with my dad having diabetes, DVT, asthma and other health conditions. She's terrified and I never want to see her cry like that again. I work for a massive coffee chain in the UK. We all knew it was really bad because of the way it was ravaging Italy and Spain. It really hit home when the company I work for shut down every store they owned. It was absolutely surreal. For me it was personal. We had been in lockdown and heard my dog got cancer. I couldn't go home to hug him and it really sunk in then. When I got off the train in Penn Station and it was a ghost town. It was absolutely terrifying considering Penn Station is meant to be a central location for people. I'd never been to Penn Station at all hours of the day and night, and there wasn't a bunch of people running for trains, eating, shopping, etc. Manhattan was also eerily quiet beyond some sirens. I work at a hospital. The Friday before we went into lockdown was the last day I worked in almost 2 months because my department was deemed non-essential and therefore we closed. I was alone in my office for hours calling all my clients. cancelling all upcoming appointments and saying we would reschedule again when things opened up, not knowing when that would be. Everyone around me was in a frenzy, also cancelling every upcoming appointment. There were people wearing masks in March when no one was wearing masks, installing acrylic guards on every booth, and putting down black and yellow tape marking the safe distance between the patient and the booth, and creating lanes to make sure people coming in and going out didn't cross paths. They were putting up a huge tent outside to create an outdoors waiting room. Everyone had a very somber attitude because we all knew no one knew when we'd be back again. It seemed something out of an apocalyptic movie when I walked through that door, not knowing when I would come back, and having seen all of that, it really hit me that this was unlike anything we'd ever been through. I firmly believed that it was an Ebola situation and the media was massively overreacting until my school announced we weren't coming back from spring break in mid-March. When I got the disease without ever leaving the house, following every single rule, and just kept myself out of the way of anyone. My friend told me when we came back from the Christmas holidays last year that China had the plague. He's very exaggerative. So I kind of dismissed it and didn't think more of it. Couple months later, Italy's in lockdown and I'm just like, damn, he was right. Obviously saying it was the plague was exaggerating though. Early April, when a former colleague who was 28 and perfectly healthy otherwise caught it and died. That's when I realized that it wasn't just bad flu. When my father-in-law died and we couldn't be there to hold him as he died. In December, when experts were trying to warn us that we were facing a pandemic. Too bad no one listened then. The whole thing could have been nipped in the bud. When my exams were cancelled and I was laying in bed during May and June rather than studying. Early March, when Coachella started talking about cancelling. As a big fest guy, that's when I realized how serious the situation was and did research on my own and got even more educated on how tough this was going to be. When I took my pre-workout on the way to the gym, just to find out it was closed. When grocery stores first started with all the safety measures and whole aisles were empty or only had a couple dented cans. Mid-January, when the first mainstream news articles started popping up, knew immediately, for no particular good reason, that this was going to be the one. Thank you for watching. We hope you enjoyed this video. Please subscribe for more videos.